Okay, so this question. So R is 0.45, which means that both the values are going up, right? And they are scattered far away, which means that there is no strong correlation coefficient. The correlation coefficient, if you draw a line totally oblique and all the dots were very close to the line, it means there is
Okay.
a strong statistical significance. So just without reading this question, just by looking at this graph,
The
uh,
first one is better.
right, there is no association. I mean, you cannot say no association because you see p-value is 0.05, 0.01.
There is association.
There is definitely association because p is less than 0.01, which means it's less than 0.05, which means it is statistically significant. So, and then this is mean childhood BMI at 4-year-old follow-up with maternal BMI. So you see maternal BMI and mean child BMI,
Mm.
right? So versus this is not statistically significant because it's going up and then it's going down. It's almost like nullifying the same effect. And then um, even the p-value is 0.23. So this graph on the right, p-value is 0.23, which means that this is not going to be our answer. Our answer is with the p-value, the statistical
Okay.
significance. So 0.01 and then mean child BMI. So let's see which option gives us that. No association. So this is not our correct answer, right?
Yes.
Maternal BMI is stronger predictor of childhood BMI than maternal A1C. So this graph doesn't give us between A1C. It just gives us maternal BMI. Doesn't say anywhere maternal A1C, right? So that's
Yes, but
definitely.
the other is related to A1C. So this
But the
one is better.
but yes, but the other one, you cannot really look at the other one at all because the second graph, the
Mm.
p-value is not statistically significant, right? It's
Okay.
0.23, which is more than 0.05, which means it's not
Mm.
statistically significant.
Okay, 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 okay.
So anything that says A1C, you have to strike it out. So maternal BMI associated with decrease in childhood BMI. So option D would have been correct if the correlation coefficient R was negative. But
Okay.
here R is positive. So this is definitely not our answer. And then A1C cannot be taken because it's in the second graph. So I would go with F. There is a positive correlated linear, this is a linear relationship, right?
Okay,
Between
okay,
maternal BMI, says maternal BMI, and childhood BMI,
okay.
right? So there's the same, it's giving you the same explanation that we just spoke about, that if R is positive, means both the values go up.
Okay.
All right. This is second question. Read the question. Okay. Which of the following is the most likely result from including the data of these participants in the analysis?
Include. When you include, you increase the power, you decrease the confidence interval.
Exactly. And so you can reject the null hypotheses, right?
You increase significance of the results, I think. There is a
Which
smaller
one?
confidence interval. No, A,
So
it's incorrect.
A
B,
is incorrect. Incorrect for sure. Yeah.
incorrect.
So A is incorrect and B is also incorrect. Okay, go on. Increase probability of committing a type 2 error. No, right? It would decrease on the contrary.
Okay.
So C is also incorrect. So increasing probability of correctly rejecting the null hypotheses. So just null hypotheses means that no statistically significant value. But when you are rejecting the null hypothesis means you are saying that there is statistical significance. So when you are that he had forgotten to include is which of following results from including the data. So you are increasing the population, which means that now the study will be statistically significant, right? So you can
Okay.
say so, and then increasing external validity of results. So external validity is a concept that is tested for using generalizability, right?
Yes.
And this is a not giving you anything about generalizability. So when you see a question, generalizability is when you can use the study to the general population. Here they have not mentioned anything specifically about the population, like is it Caucasian population, African American, Hispanic. So they would, so that this is not generalizability. So it's not external validity. And then decreasing the probability of seeing a difference between the groups when there truly is no difference. So, no difference, you cannot use this term no difference. There is a statistical significance, right?
Okay.
So that's why D, right? You understood how we got this right?
Yes, yes, yes.
So, this term, rejecting the null hypothesis, this line, the highlighted one, just says that the study was statistically significant.
Okay.
Okay. Sounds good. Next question. Okay, read this one.
Percentage cannot be included in t-test or can be included in
So,
t-test.
T test, you have the tea, green tea with your friend, right? So, tea is meant for two, right? So, only two people can have the tea, right? But here
It's
you are seeing three different groups: mild nausea, moderate nausea, severe. So, mild, moderate, severe. And there are three groups. So, you can definitely take out the T ones. And then multiple linear regression is when you are doing more than two continuous or categorical values.
but t-test was not for mean. It's not for for percentage.
So, but two. So, mean if
Okay,
you use
okay,
T,
okay.
yeah, here you have three, right? One, two, and then three. Got it
Ah,
right?
okay, okay.
So it's not T because T, then only two has to be there. Like it can only be these two. But here you have three. So, and then you have percentage. When you see a percentage and different groups, it's always chi-square. Got it right?
Okay, so three with okay.
So chi-square is when you use percentages and more than two, so like three or four groups. It's always percentages, percentages, percentage. You see percentage in the question, directly go for chi-square.
Y square, okay.
Analysis of variance will never have a percentage. Analysis of variance will have a number, right?
Number,
So it
yes.
is two or more
More than two.
categorical groups, right? So categorical, what is categorical? Like PGY1, PGY2, PGY3. So it's a number, it's not a percentage. So,
Okay.
like for residency, there would be categorical spots means it's a number. Okay, it's not a
Okay.
percentage. Versus, and then even in chi-square, the percentage is always from treatment and control. So 20% out of the 35% had mild nausea, right? So the difference is 15%. You
Okay.
understand, right? So that is
Yes.
how you see chi-square. Okay, next question. This is the next question.
So it's percentage, it's chi-square.
So, but it is percentage, but for chi-square, remember what we spoke. Okay, so the last question, you see there are three groups, right?
Yes.
1, 2, and 3, mild, moderate. So it has to be more than two groups and percentage, not just percentage.
Okay.
So, like you said, so this can be actually so t-test, but now you have two options, B and F, that has t-test in it. Paired and unpaired t-test, right?
Paired is when it's with time, it changes.
So
Unpaired, it's the
paired
same time.
t-test is when you are comparing the both are related. Okay, so for example, mild and moderate nausea, they both are related to each other. Nausea, you are
Okay,
comparing
okay,
mild nausea and moderate, so that is paired. When they are not
okay,
related, so for example, even in this question, if you see participants in the surgical treatment lost 15% of total body weight comparison to 4% body weight in non-surgical group, right? They both are different groups. One is surgical, one is non-surgical.
okay.
So that would be unpaired two sample t-test. If they both were from the same group, like surgical 15% and 4%, but surgical group, then that would be paired two
Ah,
sample.
okay. Now I understand that. Okay,
Yeah.
okay,
So,
okay, understood.
and then the explanation is also giving us the same. So, means of continuous outcome variable of two predictor groups. Two sample t-tests can be used to determine whether average weight loss is significantly different between the surgical and non-surgical groups. The null have so the same thing, right? And then this is a very good table. I think like you should just so I mean you have the account, right? So you can look at
Yes.
the chart, but this remember this chart. So categorical value chi-square when there are large study sample, lot of people, right? And then t-test is two groups, one group and then second group. More than two groups is ANOVA, but ANOVA is never in percentage. So
Okay.
okay, read this question. Which one following is the closest estimate of the probability that a subject will have hemoglobin more than 18?
I don't know.
So
Stananair.
so 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 if you are seeing that the question is revolving around mean, median, mode, standard deviation, it means that they want you to use the standard deviation formula. It's actually very easy. So for example, sample of 100 men, right? And then
Yes.
one standard deviation. So mean is 17 and a standard error is zero point 0.1, right?
Yes.
So you need, so the mean is 17, right? So if you see, mm, I lost it. So I'm not able to draw anything on this. So this is the question, right? And okay, so this is our mean, 17. Okay,
Yeah.
this is 17. And our
Yes.
standard deviation is zero point 0.1. Now they want us to know, and then this would be 18, right? Like 18 would be here, right? So
Okay.
you'll have to go 1 plus 1, right? So zero point 0.1. So let's say 68% is 1, 95% is 2 standard deviation. So how much will be left?
We have okay.
Right? So if you go 68%, how much? So for more than 8, you have to go, more than 18, you have to go close to,
So it's 34 per percent.
mm,
34 and divided by 2. It's 16.
16. Exactly 16. Yes. So
Because
it's,
68.
yes. Yes, perfect. So it's 68, and then you divide it into 2, right? Got it,
Yes,
right?
but they use it, they standard the error. Do we have to know this?
So standard error of mean means the standard deviation is zero point 0.1.
Okay,
So
okay, okay, okay.
so
Okay.
standard error of mean, this is a formula. Standard deviation is standard error of mean. So
Ah,
they can
okay.
use whatever wording they want. They can say either standard deviation or standard error of mean, and then
Ah,
root
okay.
sample size. Yeah. And then this is super easy question. Which of the following is the mode of these respiratory rates? So mode is the most frequently appearing value, right? Mode means the most common value, right? So you are seeing
Mm.
32, 32. So
32. Yeah, 32.
32, 32 here, 32 here. So 32 values, and then 23 is only 2, and rest are just 1. So let's say 32 breaths per minute.
Yes, okay.
And this will be our last question, and then we'll call it a day. Yeah. Okay. Solve this question. Which of the following is the most results of the study is most accurate? So for this, you don't have to, like this is looking a very scary table. You don't really have to. If you see the researcher in investigation, and then 5 additional patients were recruited.
Okay.
So this line, 5 additional patients were recruited, means the pool size, pool population of the study was increased. It means the study will be statistically significant. That's what they are coming to. Okay.
Okay. Okay.
So which of the option here from A to F says that the study is statistically significant?
Um, the standard deviation was decreased.
Mm.
No, it's not.
So remember that so so right now the study is statistically significant, right? The p value is statistically significant, right?
Yes.
So in other words, the
Ah, it
median will
decreased the value. Yeah, because there is a number 32, maybe. The second, the patient 12, it's 32. 32, is it? Or 92? 32, yes. So it
Mhm.
it will be negative skewed.
So negative skewed means left sided, but actually it will be right side skewed. 11, 12, 13, 14, 15, right? So if you're seeing that 32, uh, the population eventually is increasing, right?
Okay. So the standard deviation was decreased because there is a
Mm,
very low value. Yeah. Was increased.
yeah, increase. The standard deviation
Yes,
will
yes.
increase.
Was
So
increased.
yeah,
Increased.
but here it says decrease. So the mean, right? The mean is more resistant to outliers. Mean doesn't really change with the outliers. Sorry. I mistake. So mean is more susceptible to the
Yeah.
outliers.
Yeah, I think it is this one. The
Yeah.
median
Median is now
larger
larger than,
the mean.
yeah, because the mean is more susceptible to outliers when compared to the median. And then the mean value of interleukin 1 levels following the addition of new patients that were added. Uh, so the mean will change. So the median will now become larger. And this is the next question. So now,
Yeah, it can be the first one. 68 will fall between 153 and 155 because the mean it's the
mhm,
154, the last line. And one standard deviation plus
mhm.
one, it's 155, and 153 will be the 58%, 68%.
So based on which of the following is most likely to be correct? So if you are taking a population to well fitted by a normal distribution, well fitted means, so like you go to a grocery store to buy jeans, no, not grocery store, like, so well fitting means 100%, right?
Yes.
So close to well fitted means it has to be three standard deviations, so means 99.7%, uh either men or women. I would go with women because 63%, 63.7, and then 64.3 is a very narrow confidence interval. So
I didn't. Well fitted.
well
When it's
fitted means 100%, right? Like, so you can take three standard deviations,
okay,
99.7. So totally well fitted means like you can use it in 100% population, right? So for
okay, okay,
example, Tylenol, 100% people can take Tylenol and it is safe. That's why it's over the counter, for example, right?
okay, okay,
So that's why you take the three standard deviation.
okay.
Got it right?
Okay.
And then let's see this option, right? For men. So when you are taking men, it's only taking two standard deviation range for 68.8. Versus in women, it is taking all three standard deviation of zero point 0.3 inches. For men, right? Standard deviation of zero point 0.1 versus for women, it is
Okay. So you need to know that. Because it's not in the question that women you need to use 3 standard deviation and men you need to use 2 standard deviation.
No, so for men they took 69 and women they take 64, right? So 3 standard deviation would be 64.3, right?
Okay,
Upper, and then lower would be 63.7, right?
okay,
But for men, if you take men, 68.8, here they have 68, it's going to be only 2 standard deviation.
okay,
They did not take, so they said 99.7%, but this is not 3 standard, it's only 2 standard deviations, right?
okay.
So you got it right.
Yes,
So they, in the first part they said 99.7 is 3 standard deviation, but in the calculation they only have 2 standard deviation. This is not 3 standard deviation. See, 69 for men, and
okay,
then yeah, so it's only 69.2 is going to be only 2 standard deviations. Needs to be 69.3 for 3 standard deviation, right? You understand, right?
okay.
Okay, let's move on to another question.
Yeah,
You got this question? Any confusion? Ask me.
no, that's okay.
Okay. Okay, so this one, which of the following 95% confidence is most likely reported in this association? And then we are seeing that p-value is 0.02, which is statistically significant 95% confidence interval. So this question is exactly like we discussed before, the ratio 1.74, right?
Must
Of
be inside.
inside in the middle.
So D.
D, exactly. Perfect. Yes, perfect. You got it right.
Yes.
Okay, now this one we are seeing that it is positively,
Positive.
but it's scattered very far. So this dot is not close to the midline.
So it's less
So,
than 1,
so it is less than 1, but
but
is it
it's positive.
positive? So, and then it is going like this, right? It's going
Yes.
diagonally. So it's going, so it's, this is 90 degree, this is going to be 45, right? Right?
The more based on this one. Isn't it 1?
So this is 90 degrees. You'll agree,
Yeah.
right?
Yes.
And this is going to be 45, right?
Yes. Yes.
So you said positive, but
A little bit
half.
not perfect.
Not perfect, but so this is our line.
Yes. Yes.
So we will take positive of 0.45. You got it?
Okay. Okay. But the correlation isn't it a number closer than 1 when it's perfect? 1?
So when it is perfect, it has to be on the line. But here we are seeing it is all scattered. It's not,
Ah, yes. Okay. 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 Okay.
you
Okay.
got it,
Yes.
right?
Yes. Yes.
Yes.
Yes.
Okay.
Yes.
Okay, this is the next question.
So chi-square, it's categorical.
So it is categorical, that's correct, but they have how many groups?
Three
So
groups.
three groups. So it's definitely not t-test, not Fisher, right? It's not Fisher, it's not t-test, two sample t-test, and it's not Pearson's correlation as well, because Pearson correlation is like, the last question we did, R is positive correlation coefficient, one is increasing, the other increases as well. That is Pearson's correlation coefficient.
Okay.
So
Okay.
A versus B, so that is Pearson. So it is definitely not these three. And then we know that it is not percentage, right?
Yes.
So it is not chi-square as well. So it is analysis of variance. So this says into three groups, right? Three groups.
But chi-square can be more than two groups.
But
Or
chi-square has to be percentage, and then chi-square is categorical, right?
yes.
So we did this question on mild, moderate, severe nausea, but in percentages, where treatment versus control, but in percentage. So this is not chi-square. It's definitely not Fisher, not t-test, not Pearson's. So it's analysis of variance, ANOVA. So if you look at chi-square, it's large study sample, categorical. Analysis of variance is also categorical, more than two groups, but it's not in percentage. Let me show you the question on chi-square. So this was the question we did on chi-square. See this?
Yes.
So it has percentages, and in this study, independent categorical variable is treatment with control versus control. You see that?
Yes.
So treatment versus control, more than two groups, and in percentage is chi-square.
Okay.
I think we missed this question, but we'll come to it later. Okay, so this was analysis of variance. You got this, right? How we got this one?
Yes.
And also another fun fact about ANOVA is that all the three groups will revolve around each other. So they are all about mini mental state examination. Got it right?
Yes.
Next question.
Eight, 85. Power, it's 1 minus beta.
Perfect. Oh my God. Perfect. Perfect. Yep, you're right. Power is 1 minus beta. So you have 1 minus 0.15, which is 0.85. So 85%. Okay, this one. So this question is exactly like the one we did before. You have a classical example where population increases. The researcher is examining the relationship between socioeconomic status, IQ scores. IQ scores of young American adults have historically been reported to be distributed normally with a mean of 100, and then standard deviation is 15. And then part two, researcher received additional funding to enable increase in sample size, right? 2,000 participants. So from 100 to now it's 2,000. So when
It can
pop,
increase the confidence interval.
so no, so if you are increasing the sample size, the p value goes down, right? The p value becomes statistically
Yes.
significant. And then the confidence increase in range means you are widening the confidence interval. When the study is statistically
Yes.
significant, the confidence interval actually becomes narrower, right? So A is
Yes.
definitely not the answer. In other words, the type 2 beta error decreases. So won't you say that decrease in standard error of mean? No?
Hmm?
Decrease in the standard error of mean? If
It's
P,
it's the same of decreasing standard deviation.
no, standard
No.
deviations, no. So standard deviation means that 68% is one standard deviation. The standard deviation doesn't really change,
Okay.
right?
Okay. Okay.
So 68%, no matter which study you take, standard deviation, 68% will be one standard deviation, right? Regardless of the,
Okay. Okay. Okay.
so standard deviation is very protected and stable, like doesn't change. So standard error like mistakes. So if you decrease the p value, you are decreasing the error, right?
Okay.
So
Okay. Because of the formula. Standard deviation divided by the number. If you increase the number,
So
you
it's
you
not
decrease.
really number, it's root n, which means if it is 100, it's going to become 10. 10 tens are 100, right? So root n means you are rooting a population, like it's inverse of square. So 10 tens are
Okay.
hundreds. So it's root n, yeah. So remember, there will always be this word game in the option choices, standard deviation and versus standard error. So standard deviation is static, doesn't move regardless of the study, and it's always represented as 68% one standard deviations, 95 2, 99.7 is three standard deviation, and then standard error of mean uh, is what increases is decrease. Pretty simple way to remember is error. You are decreasing the p value means you are decreasing the error, right?
Okay. Okay.
So that, okay. And now let's see. So there are 20 more questions in the same block, but I think we didn't solve this question. So let's solve this question. Read this question.
I think we can change to another topic. No.
Yeah, we can actually. Yeah, let's move to something else. So yeah, just go ahead and complete this block later on. But
Okay.
okay, then study plans. Okay, so Next, when we meet, we can do cardiology, reproductive.
Yes. Okay.
So
Cardiology, please.
cardiology is 20%, infectious disease is 20%, pulm is 12%, OBGYN, GI is 10-10. So we need to definitely, so you want to do some cardiology here? New custom session.
But what
Uh,
are the concepts that are most common asked in step 3 for cardiology?
Next best step. So pretty basic, like murmurs, increasing, decreasing murmurs. Actually, they have a very, so I will send you this document as well. Uh, do you see my screen?
Yes.
So this book is called Bomber. It bombs. Um, so hemonc, renal, mm, let me see cardiology. Last minute read, OBGYN, family medicine.
Because it's different from step 2, isn't it? The concepts that they ask.
So yes, so this is the cardiology PDF I'm going to send you. It has, okay. So this is how they will test you. I will send you
Ah,
these are
okay,
only
okay.
75 questions, but these are extremely high. I can almost guarantee you will get like at least 4 questions, 4 to 5 questions from these 75. Guarantee you. Guaranteeing you means like guaranteed. So for example, symptomatic carotid stenosis more than 70%, you go for carotid endarterectomy. This is going to be in the option choices indicated. Biggest stroke risk is from 80 to 99%. Asymptomatic, no symptoms, but patient has 80 to 99% occlusion, still go ahead with carotid
Yes.
endarterectomy, CEA. Okay.
Yes.
Asymptomatic, so we just discussed, right? This one. Okay. Now, carotid stenosis below thresholds, medical therapy. Let's say patient has 65% carotid stenosis, go for medical therapy, ACE, ARB, antiplatelets, and then high intensity statin. Question says patient has uncontrolled hypertension because of non-compliance, S4. On auscultation, US4. Also, do not try to listen to the heart sounds in the
Okay, okay. Thank you, thank you, thank you, thank you. Thank you.
S4 long-standing hypertension, left ventricle hypertrophy shows stiff non-compliant left ventricle and then late diastolic atrial kick sound. Right? So S4 means late diastolic atrial kick. Okay. New onset left bundle branch block plus S4 heart sound, and then there is chronic afterload. What does that mean? It means that diastolic dysfunction physiology eventually cause decrease in compliance, right?
Okay,
Compliance means ejection fraction.
okay,
So they can sometimes say decrease ejection fraction. So that would also be a correct answer, right? Now, next question says black patient with HFrEF, reduced ejection fraction, HFrEF, with persistent symptoms of uh, decreased ejection fraction like shortness of breath, and patient is on guideline based medical therapy, GDMT. What do you do next? You just add hydralazine because the patient is African American. So hydralazine is number one drug of choice for HFrEF in African American, hydralazine, and then long acting nitrate. Why are we adding hydralazine and nitrate? To decrease mortality and decrease hospitalizations.
okay,
So why don't I do this? You go through this PDF. I will send it to you. But
okay,
this is
okay.
extremely high yield. What is adrenal crisis? These are the arrows for adrenal crisis: decreased blood pressure, decreased sodium, increased potassium, low bicarb, low cortisol, low aldosterone. Okay. Okay, MAP, mean arterial pressure less than 25% in first hour is hypertensive emergency. Mean arterial pressure more than 60%. What do you do next? Start them on levofed, right? ICU transfer and start them on norepinephrine, levofed. I'll just add another question. MAP more than 65%. Start norepinephrine, levofed. Okay. What is pancreatitis? Pancreatitis means sudden onset abdominal pain radiating to the back, right? There'll always be this word radiation to the back.
Okay.
If patient has pancreatitis plus GI bleed plus isolated gastric varices, suspect what is your number one diagnosis? Splenic vein thrombosis. And what is splenic vein thrombosis? Splenic vein thrombosis is left-sided portal hypertension. And then portal hypertension, what do you do for prophylaxis? Nadolol, non-selective beta blocker.
Oh, I didn't know that. Not at all.
So let me see books. So you see this Nadolol here?
Yeah.
You see variceal bleeding, and this is first aid for step one. So I don't think that they will not ask. They will definitely try to ask around. You might get lucky, but this is high yield concept. Variceal bleeding decreases hepatic venous pressure gradient and portal hypertension. So prophylactic use, you use Nadolol first,
Okay.
is Nadolol. Propranolol second. Then once you pass Nadolol, propranolol, carvedilol is very cardiac selective. Carvedilol, okay? So carvedilol for no portal circulation. It's more like acting on the heart.
Okay.
All right. Then, so yeah, so what I'll do is I'll just forward you this, go through it. It's a easy read, very easy to read,
Okay.
very
Okay.
easy to remember, but extremely high yield. Sounds
Okay.
good. I'll see you next time. All
Okay.
right. Sounds good. Take care. Bye.
Bye. Thank you very much.
No problem.